Thank you for invitation. Good day, everyone, and I am very glad to be on Icarus conference this year. And let me show my case with iatrogenic occlusion of bilateral jugularis, subclavian vein, and vena cava superior, and endovascular treatment. Arnold-Chiari syndrome, this is a congenital defect of hindbrain and skull. Symptoms are dizziness, paralysis cranial nerve, problems with balance or coordination, incontinence, and sleep apnea. And only one treatment option is a neurosurgical operation, and usually sufficient is inserting ventriculoperitoneal or ventriculoatrial Pudens valve. Clinical data, 37 years old man with long-term diagnosis of Arnold-Chiari type 1 syndrome after 2 neurosurgical interventions with Pudens valve implantation 27 years ago and replacement 20 years ago. Fortunately, current valve in peritoneum is patent. The patient is after neurosurgical treatment of subarachnoidal cystis. And finally, after neurosurgical procedure, after many central vein cannulation, we have bilateral occlusion of jugularis and subclavian vein and occlusion vena cava superior. Symptoms: very big facial and head edema, headache and vertigo, vision disturbances. On this picture from NGCT, we see occluded both jugular veins and valve, and occluded vena cava superior. Plan our treatment after diagnostic procedures: NGCT, angio-MR, and venography. We try to recanalization and angioplasty with stenting, with using stents dedicated for venous system. Planned vascular access, patent part of right jugularis vein, vein femoralis, and radial artery. On this movie, we can see contrast agent from patent part right jugularis vein, and we see many collaterals on this region. Next steps from procedure: we use 2 wires, and we can see picti in aortic arch. And finally, angiogram from the procedure. We use 2 stents, one long stent zilver vena and shorter stent on distal part of jugularis vein, carotid stent, wall stent. Pharmacological treatment after procedure: the first month aspirin and clopidogrel and low molecular heparin, and after 1 month we start with dabigatran twice per day and aspirin 75 milligrams, and this is long-term medical therapy for this patient. Our patient is still under follow-up, and during 2 years we perform a few duplex examination. Both stents are patent. 1 and 2 years after procedure we perform angio-CT scan, and now patient is without symptoms, professionally active. And now we can see control angio-CT reconstruction 1 year after procedure. And next picture from angio-CT 2 years after procedure, we can see marginal thrombosis in zilver vena stent, but both stents fortunately still are patent. and reconstruction from this CT scan. Summary: goal of our treatment completely successful. Patient now is free from symptoms and returned to professional activity. Patient is still under neurological and vascular control. Data from this case was last year published in Journal of Vascular Surgery, Cases and Innovative Techniques. And short conclusion, very short conclusions. Risk of failure in this case, in our opinion, was high from different anatomy in daily practice. We treat arteries, not vein. From this reason, we need more caution during procedure. Diseases and anomalies in central and peripheral venous system are another challenge for endovascular therapy and techniques. Thank you for attention.